Hello, welcome back to Simply Women's Health with CJ. Today we're going to talk about what to expect at your first OB appointment. So many of my patients come in, especially the first-time moms, and they're real nervous. They don't know what to expect because they've never been pregnant before, and they have a lot of questions. So hopefully today I will be able to put your mind a little bit at ease and make it a little bit more comfortable for you when you show up for that first OB appointment for you. So the first thing your provider is going to want to know is what was the first day of your last menstrual cycle. That's how they're going to assign your due date and figure out exactly how far along you are. If you're not sure about the first day of your last menstrual cycle or you have irregular periods, give them an estimate. They can always work with the closest thing that you can figure out. Your provider is going to want to get a good health history. Do you have any long-term health issues? Are you a diabetic? Do you have a history of high blood pressure? Do you have asthma? Do you have any mental health concerns? Have you ever had any sexually transmitted diseases? Herpes is one of them that we really look for because that can be passed on to the baby during a vaginal birth. Do you have a history of any kind of surgery, especially surgery on either your uterus or your cervix? Those are things that your provider is going to want to know as well. Family history. Do you have a strong family history of diabetes? Did either your mother or your sister have preeclampsia during their pregnancies? Your provider is going to want to know that to see if you are at increased risk to develop high blood pressure later in pregnancy. Your provider is going to order a whole bunch of lab work. They want to make sure, A, that you don't have any sexually transmitted diseases. They do a full panel, which will include HIV, syphilis, hepatitis B, usually hepatitis C. They will check for gonorrhea and chlamydia. They're going to want to know what is your blood type. They want to know what is your Rh factor. These are very important things that we need to know, especially in pregnancy. They're probably going to order a gonorrhea and chlamydia screen, and in all likelihood, they will get a urine culture as well. They're going to make sure that you are immune to German measles and probably make sure you're immune to chickenpox. That's why the big lab work panel, and that is typically done at the very, very beginning of your pregnancy. During your visit, your provider is going to probably talk about the do's and don'ts of pregnancy. They're probably going to give you an idea of what to expect during your pregnancy as to how their practice works. They're going to want to get a height and a weight. They're going to calculate your BMI, and that's your body mass index. And based on your body mass index, they will advise you how much weight they recommend you to gain during pregnancy. They may want to do a head-to-toe physical exam. Some providers like to do a breast exam. If your pap smear is due, they may recommend getting your pap at that visit as well. If you have not had an ultrasound already, some providers will do an ultrasound at that first visit, to confirm that the baby is in your uterus where it belongs. They will also want to make sure that your dates match up with your last menstrual cycle. A first trimester ultrasound is actually very good for dating. If you've already had a dating ultrasound and you are 10 weeks or beyond, your provider may listen to the baby with a Doppler. Your provider may want to talk to you about genetic testing. Now, if you would like to have information regarding genetic testing, do's and don'ts of pregnancy, what's normal, what's not normal, I strongly encourage you to check out my content on this site where I address those issues in detail. Hi, if you're still here, thanks so much for sticking around through the entire video. If you feel as though this information has been helpful to you, or you think you know somebody that might benefit from the information provided in these videos, please feel free to like it, share it, and if you haven't already subscribed, I would love it if you did that. Any and all support that you can provide is so greatly appreciated. As always, these videos were not created as a replacement for a visit with your healthcare provider, rather as a place for you to come for basic, reliable information that is non-biased and hopefully allow you to figure out what questions to ask your healthcare provider at your next visit to best meet your healthcare needs. Again, I appreciate all of your support. If you want to contact me, my information is at the top of this screen, and I will put it in the comment section of this video. That's all I have for today. This is CJ. I'm at your cervix.